guys, welcome to the Women in Sports Therapy podcast from the Sports Therapy Association. We are your hosts.
I'm Fiona.
And I'm Debs.
And today we're talking about menopause and perimenopause. What's the difference, as well as predicting the onset of either of those things, as well as preparing for the symptoms too. There can be quite an impact, on work life, and we're going to talk about perhaps from a sports therapy perspective and related manual therapies, how that might impact working with different groups that you may have coming into your clinic environment, including recreational activities and professional athletes.
Yeah, managing symptoms, getting help. It's leading on to individual podcasts that we might do in future, covering each subject in some more detail, I think, as well.
Yeah, we'll expand on these things in future weeks or months, but we want to really talk about how to initially start conversations with members of your family, or how to encourage those people that we're working with to discuss these things in their workplaces maybe, or with their loved ones. And of course, we'll be sharing our experience and knowledge, or what we have of it. We were just discussing before we started this podcast how actually I think I had not realised that I absorbed so much information just from my environment. And, Debs has had quite a bit of experience working with clients in this area in her therapy practice. So yeah, maybe that's a good place for us to sort of kick off, really. And you've got some facts there as well, I think, just to kind of get us started with what sort of symptoms we're looking for. And
let me just get the facts to hand, so that I'm definitely not just quoting off the top of my head.
You can make something up. I'm sure no one will question it.
So I think I quite like a good old stat. I think it does give us some good foundations as to where you're going, and it's not just that we're wittering on about a load of old rubbish here. These are real problems that we face as therapists, and women face, in sports therapy. This is exactly what happens, basically. So 10 common signs of menopause. Now, I think we were discussing earlier today, Fiona, about the differences between perimenopause, menopause. So I think we'll go back in a minute and say what that is. But let's do 10 common signs of menopause. Absence of period for 12 months, hot flashes, or flushes, some people say, night sweats, mood swings, irritability. Is that just not normal women, apparently? Reduced sex drive, problems with memory and concentration. I often hear that, definitely. Difficulty sleeping, cognitive changes. So what does that mean? So difficulty in remembering names, directions, losing focus, losing your train of thought. And then physically, vaginal dryness and vaginal and vulva itching. I have been told about that quite a bit as well. So 10 common signs of menopause. So I think that you had a really good definitive answer to this when I said to you, so I'm going to really put you on the spot here, Fiona. But when I said to you, so what is the difference? Because I'm kind of reading it and making sure that I understand it. And you had it so eloquently put. Can I say that to you again? So please, Fiona, tell us the difference between perimenopause and menopause.
Wow, this is the big thing, I suppose. Like, perimenopause is a word that perhaps hasn't really entered into the conversation quite as significantly in previous years or decades, but certainly the conversation around it now. Perimenopause is the phase of where you start having some symptoms that precurse a menopause. Your menopause is when you've gone 12 months. It's just a day. It's the day that you've gone 12 months since your last period. And it happens to kind of fall into, an age category if you're over the age of 45, you're probably more likely to be heading towards your menopause. And perimenopause is the years preceding that, where you start to get symptoms that indicate changes, particularly a reduction in estrogen, but changes in all sorts of hormones that might influence your menstrual cycle or your ovulatory cycle and your fertility. And we did hear, I think both of us hadn't been too familiar with the word premenopause, and that was something we were just discussing before we started this recording. Premenopause we found as a term that's relating to anything before you start experiencing perimenopausal symptoms. At least one place has mentioned that, but I think Debs found perhaps another definition somewhere else. So I think it just highlights that we're still not all speaking the same language when it comes to menopause, and whether that's, you know, down to miscommunication or just too much information to filter through and get the definitive kind of terms down pat. But yeah, like there are several stages. There's also post-menopause, which is after you've had that final day of the 12-month period after your last period. You know, you are post-menopausal after that menopause day, and it is possible that you could have a period during your post-menopause years. It's just that it's unlikely to be returning. It's just that it could be one or two that kind of are caused. And I remember hearing something absolutely fascinating. I'm sorry, I'm just going off on a tangent here now, but like it just triggered a memory for me. I can't remember who it was that was talking about it, but they were saying that, you know, it's possible. They've done dissections of cadavers of older women, and they still have eggs in their ovaries, but it's just not been released. So it's certainly, you know, more linked to do with there are more links to the maturing of the eggs and the releasing of them and ovulation tied into whether or not you have a period than just the eggs have gone. It's really quite a complex process going through menopause, as you'll find out as we talk about it today. So yeah. So Debs, you look, we are recording this on YouTube, and I'm just looking at Deb's face. She just looks absolutely like engaged in so I'm sure she's found some fascinating facts.
I was just remembering that Matt had done an interview with Jenny Burrell, who we will be having on our podcast at some stage, talking about, so I was just having a look when that was, and it's something that we can actually refer to back to some of the stuff. So it's the 87, so STA 87, menopause transition, soft tissue implications. And really, when I listened to Jenny talking about it, so hi Jenny Burrell, when I was talking with, listening to Jenny, and just the way that Jenny was putting it across and saying, you know, the impact as a therapist myself, what that has on some of the clients and patients that I see. Like I said, you know, I have experience of people coming into my clinic based upon all sorts of symptoms that they come to me, and especially women that are doing recreational sporting events for themselves, and how they were at 20 and they're still expecting their body to do the same thing at 50, and I'm like, there's 30 years in between, it ain't gonna happen, lady, you know. And they forget, you know, I'm 47, I forget. I was just working out when it was. I couldn't remember when Jenny's was, so that's what I was doing on the computer.
Yeah, no, that was a great episode. I honestly, like, I can't wait to speak to Jenny, and she said something that was so prominent in my memory after that, you know, that really, I think, you know, speaking with female clients, if you're not female or you don't have a female body, you know, if somebody's paying you to work with their body, you should know how it works, basically, was the bottom line, the impression I got. And it's so true. I mean, we understand our own, you know, bodies, but do we understand the client's body, and are we being sympathetic to the fact that we don't always know what's going on? We just need to acknowledge it, really.
And often it's something that you bring up, Fiona, with transgender possibilities, or people identify, even if they're not transgender, they may identify as not the sex they were born with, and the complications of what a female birth produces over the term and staying female, to what may happen should somebody change. And of course that's hormonal change that then changes stuff. Say for example, a woman then turns to a male identification, and what that level might happen still follows a pattern of possible, you know, menopause and things like that. And you just think, well, hang on a minute, that client may be in front of you at some point, and how do you handle that?
Absolutely.
just again, like I said every episode, just talk to them, just talk to that person. If they've come to you, they're expecting questions. You're in a medical capacity, even if you're not a doctor. I mean, obviously you are a doctor, but even if you're not a doctor,
different kind.
Oh yeah. But to just talk with people, just open it up and say, how are you feeling? And it is about you personally, isn't it? And as women in sports therapy, what is that individual person doing? So if your client is male, or if you're a male therapist, it's still a body on your table,
right.
you know, and you've got to be sympathetic to whatever that body is going through yourself.
Yeah.
I think.
Yeah,
that's what I was doing. I was trying to find when Jenny's podcast went out so that people could refer back.
Yeah, please do. Really would point you towards Jenny and the SDO podcast, of course, as always. Trusty, reliable source of information. Yeah, like, so actually what we were talking about there, I think, leads nicely into symptoms, to be honest. Like, so we know that there are various phases in sort of a menstrual lifetime, if you like. And then what kind of stuff you found some kind of lists, I suppose, of like, there are seemingly endless list of symptoms, but what have we got?
So obviously the perimenopause is these stages that a woman will be going through, but they can present in different ways in different women. So each woman is unique. So often a woman will go to the GP and saying, I've got this, and they'll say, the GP may say to you, it could be, you know, the early stages of menopause. Actually, can I share something? Do you mind? I'm going to share.
Feel free, yeah.
With the listeners as well. So I'm 47, and I was controlling my own changes because of endometriosis. You guys all know I've got endometriosis. And I was doing advice supplements, and I was fine straight after a laparoscopy for about 6-7 years, controlled it with supplements, etc. And then obviously I got to a certain age and everything started to go a bit crazy again. And I'm thinking, oh no, well now what? No, you know, another imbalance. Brilliant. So I spoke with the doctor, and we decided that we're going to put me onto a contraceptive pill, which is a combined pill, progesterone and estrogen. That's helping with my menopause, but I can only, or perimenopause, but I can only stay on it until I'm 48.5 because of the endometriosis, and I've got to look at other things, and they won't let any woman stay on a contraceptive pill past 50. So what are the alternatives? So what I'm sharing with you now is I went in to collect this free contraceptive to a pharmacy, and the pharmacy said, oh, can we just pull you to one side? So I said, yep, absolutely no problem whatsoever. And he said to me, we notice your age is 47. Yep. And he said to me, well, why are you having a contraceptive at 47? I said, because I might still be able to get pregnant. And what he meant is that the NHS don't seem to be providing a free combined pill, which is effectively a contraception, to women that are actually going and using it as a hormone replacement style of therapy. And that really triggered with me. I wasn't aware of that.
Wow.
Yeah, so I did embarrass him in the shop because I was really embarrassed myself, and I thought, how dare you? And I did say, well, that's because I could, but that's just me. But I don't advocate that you should do that. But it was quite interesting that up to the age of 45, you can get a free contraceptive pill, but the doctor hadn't listed it as a contraceptive. They were listing it as a medication to assist with hormonal changes to do with the perimenopause. I just wanted to share that with listeners because I fought my case and went, well, if I've had that contraceptive pill when I was 17 years old and I'm 30 odd years later, I'm damn well not going to pay for it now. I will go through the menopause, and I felt a bit angry about it, but actually I think it's a good thing to share.
That's interesting. So it was the nature in which it was, like the sort of the purpose for which it was prescribed defines whether or not it's funded by the NHS. And I think that's a really murky area again, as well as obviously if you live in Wales, I don't know about Scotland, but in Wales certainly you get free prescription medication on the NHS, whereas in England it's, you have to painfully hand over cash just to get basic prescription for one medication, and how do we sort of define something as being for a medical purpose or not? That is something really worth discussing with your GP.
Yeah, absolutely. And I think that's why I wanted to share it, because I felt like, well, up to the age of 40, whatever, I have the choice whether I want to have sex and procreate or whatever I want to, whatever. I don't have the choice when I'm 47 that I've gone into perimenopause. I don't have that choice anyway, whether I like it or not. So I thought it was quite a nice thing to share on here.
Yeah, definitely. And I think that's easy to forget that, like, just because you reach a certain age, and I don't know about you, but I think mentally we don't really age. You always think of yourself as like you reach a sort of like, I don't know, prime age, or like something. We never feel our age in our minds. Sometimes I hear people say, I feel really old today. Like, I feel like I'm 100 years old, or, I don't feel my age. I mean, I constantly in my head, I'm saying the next birthday that's coming along, like I'm 35, and like I already see myself as 36, and like when I was turning 30, I was like 29 years old, but I was in my head, I was, somebody asked me how old are you, I'll be like, oh, 30, I might as well say I'm there. But yeah, you from a mental perspective, to have that a societal kind of burden of being like, you've reached your shelf life, like this medication is now for medical reasons, not for contraceptive. It's
I think a lot of the time, like the clients and patients that I see, sorry to interrupt you there, Fiona, they go to a GP and they initially get put onto antidepressants straight away, because women will feel low, their self-esteem has plummeted because the hormonal fluctuation again has happened. And they'll go with, oh, I've got these really bad headaches, and I've got these hot flashes, and they go, oh, that could be menopause. Oh, but it also could be depression. Let's put them on antidepressants, because then it suppresses some of this stuff. And that's often the cheapest version through the NHS. And actually, just sort of sidestepping that slightly, again, I'm going back to diet, but you can have a look at what helps you through it. And I advocate starflower oil, and I advocate, magnesium at night and things like that. And based on seeing people over and over and over, and seeing their symptoms change once they've come and had some therapy with myself, and I'm sure there are other soft tissue therapists across the UK that give out this kind of therapy in a relaxed state. They're taking supplements, they're utilising what they have around them. So I try and incorporate everyday life stretches. So they'll come out the shower and they'll do sort of the shoulder stretch, or they'll do this wall stretch that I do, and I call it silly names and things just to make them do it. But it's trying to build a life where, like you said, it's not about you're over the hill now. This is this is just another transition, another change within our mindset. We were talking about Japan and stuff. But it's just another way. Sorry, listeners. Basically,
yeah, explain that.
Yeah. So women in Japan, I've been told and researched that they are revered as they get older. So the wisdom and what they bring and all the changes that they go through is a revered thing for the youth to look back at. Fiona, I think you've frozen.
Oh, am I back?
You're back. Yeah, kind of.
I'm back in the room.
You're back there with us. So based on that, it's more about, this is just another transition that we're going through. And if you kind of have that mindset, you go, okay, how do I deal with this one? How do I cope with what's coming at me? And it isn't pleasant, some of the stuff like we've said about night sweats, hot flashes, it's not funny, some of it.
Yeah. And I think the frank conversations like that I've had with people who are going through it, once you start a conversation with somebody that's going through and experiencing these symptoms, it becomes much easier to sympathize and empathize. And I know that a lot of the issues that, they describe, especially symptoms of, mood swings and irritability. And there's this sort of really stereotyped view of middle-aged, women in particular, becoming quite blunt or easy to get a rise from somebody, or quick to snap. under pressure, or maybe even, you know, in terms of mentally having the capacity to deal with stress or that kind of thing, brain fog, you know, it's quite damaging to a person's mental, you know, their self-esteem and their image, to feel that they're being judged based on these symptoms when people don't actually understand the underlying cause of it. You know, you can experience a sort of invisible disability, if you like, in other kind of conditions, but every single woman who goes through from starting you know, periods will stop having periods at some point in their life, and they will naturally go through the menopause. And so 50% of our population who reach that age are being misunderstood potentially in their workplace, by their family members. There are stress put on relationships, and it's caused by something that isn't really talked about. It's becoming more au fait, but it's very damaging. Yeah, and we need to make sure that we recognize in our clients these symptoms, because that means that we're giving them a voice and giving them the opportunity to acknowledge that there's something happening in a more formal kind of way. Because I think a lot of people don't seek help, do they? They can try to deal with it on their own, which is fine, but there are things available to help them. And manual therapy is, like you said, manual therapy is a wonderful tool to use.
Well, I have a lot of people that women that come to me, and you know, I'm sure that male therapists often hear stuff like this too. So how, you know, how does somebody that's male help a woman? You know, do they want to talk about, oh, I've got this situation, I've got that situation? But I just know from people I see, you know, women that have done marathons, or women that are competing in a tennis tournament, or, you know, whatever they're doing in the sports world, where they used to be, and then they're getting frustrated because they're not doing it how they did before, and they don't really understand why. And then we kind of go through a few things. They may see me a couple of times, and then we think, okay, actually this sounds like perimenopause, you know, just let's try changing some of the things in your diet, let's try some supplements, let's see what's, you know, the overall health, because I think we've gone back to where I came from initially, which is like overall health. But I think some of the women that come to see me don't realise, they then have no idea what's going. They're just, oh, something's changed, and I'm aching, I'm really aching. And I see people in pain first before anything else. But people don't come for a luxurious massage. It's not what it's really about, you know. It's this sort of pain management. And then they then, like we should all do as therapists, they then are signposted somewhere else, because I'm not the expert in every field. So for me, I'll say, okay, this sounds like, I suggest you'll go and have, like I would, you know, if somebody's got a painful shoulder and they've slept on it funny, okay, we can try and correct that over a couple of sessions. But when it's not working and their job is, you know, a stonemason or something, I'm like, can you go and have an MRI? You know, I can't do that. So we can signpost the same with women, you know, that are going through a transitional stage. And let's not think of it as, oh, it's the menopause, you know, let's think of it as another transitional stage. When we are, as women, some of us may have been lucky enough to be pregnant, or not lucky enough, depending on how you view it. But pregnancy is 9 months if you're lucky to go full term. So pregnancy is 9 months, and people go, oh, I've got baby brain. But there's an end date. With menopause, it can last 10 years. So women are frustrated and going, I just want to be how I was, you know. And there are tools and ways to do that. So yes, there's HRT, and I was going to pick up, you know, Kate Garraway and Davina McCall, and you had some stuff from Maisie Hill, which I was fascinated. Do you want to share some of that stuff, Fiona?
Well, I mean, like, really, this is a perfect situation where I will signpost, but Maisie Hill is an author who has written a fantastic book called Period Power, which is something that I picked up a couple of years ago. And she's recently published a book called Perimenopause Power, I think, again. And she's got a membership group that provides support to people with various issues who are, you know, going through maybe a condition or a diagnosis, or just trying to get to the bottom of symptoms that are bothering them in their kind of day-to-day life that might be linked to menopause or menstrual health. but she has outlined, some really useful information. I would definitely flag, that as a resource that's been a font of knowledge for me, Period Power. But also, I haven't quite finished the second book, Perimenopause Power, but certainly I'll put the link in the show notes, so that you can find those resources. And like you said, Kate Garraway and Davina McCall, people in the public eye who are trying to raise the profile and awareness of the influence of menopause. I actually, I just realized that I think in the corner of my eye, I've got my notes in front of me, and we didn't actually talk about postmenopause, and you described that window of time as being potentially 10 years. And I should say that could span either side of menopause. We have pre-menopause, which is just the normal kind of, I say normal, it's just the phase where you're having regular periods or a menstrual cycle. And then perimenopause is peri being, peripheral or a perimeter, on the boundaries of menopause, and meno meaning menses, and pause meaning pause, what it sounds like, the peripheral kind of time around menopause. But once you pass that menopause date, 12 months since your last period with no periods in between, you are in postmenopause, and that can go on for some years. That could be included in that time where you could be into your 50s and 60s, and even like I said, people have periods like randomly at some point in their later life stages too. And obviously if you do experience a period after menopause, you must go and see your doctor. You must, that is something that I think we perhaps somebody may not want to share with you as well. They may be completely confused as to why they are bleeding, and they may not think that it's something that could be more serious, but it could potentially be something that's not related to a menstrual cycle at all. It could be something more serious, a red flag. So a red flag, a very red flag.
I think something, just going back to your Maisie Hill signposting, what I found particularly interesting that you said about off air, like off podcast, was that it was the messages. I found that really interesting, because I was likening it to a music style of like call and response, and when you were children, you learned call and response type of Frere Jacques type song, and how your brain, you explain it so much better than I do, Fiona. Can I pass that over to you to explain what she was saying?
So I'm certain that it was Maisie Hill, and please forgive me if I've picked this up from the wrong source, but Maisie Hill gave this example where when we think of menopause, it's the symptoms, but what's causing it as an underlying factor is that our hormones are changing, and potentially there's a reduction in the amount of production of estrogen and other hormones in the body. But it's not just the amount that can cause the symptoms and start to create these changes as we get older. It's actually the signaling. Hormones are chemicals that are used to signal within the body, and we're emitting, let's say estrogen is sent and received. If we're producing it on a regular basis to a rhythm, and suddenly that rhythm is off, then it's not being picked up at the same rhythm at that receptor site. So it kind of has an impact on the production of other hormones and other processes that are going on in the body. And I think she kind of phrased it that, we're sending out signals, or there's some kind of emitting of a text message, and it's not being received at the time that the person is receiving. There's something like that anyway. Like Debs likened it to a musical kind of example, which is much more relatable, I think, than I can give. My nerd brain kind of kicking in. It's like, Dr. Higgs speaking.
It's a really good analogy that actually your body is talking to itself. We think that we are in control, but I guess you can regain control, but also that your body heals itself, repairs itself, and you need to give it patience and time. Right. And you're not going to be like you were when you were 20. You're going through a transition, and just accept that to a degree. It's hard. I think it's hard for us to accept the changes that are going on and think there's something wrong, when actually it's perfectly natural. We should be going through these changes. Some of them aren't fun, really not fun. But it doesn't mean that a quick patch, I've seen a lot of patches, a quick patch or a quick gel on our thighs or whatever is going to fix it, because all we're going to do is just mask those symptoms whilst we ride the transitional wave. And like if we can kind of try and look at that mindset rather than come and have therapy, come and have a massage, and come and have your time out and what's good for you. Because like Jenny was saying, it does affect soft tissue. Of course it affects soft tissue. It's the purpose, of course, and it's your brain sending messages to the rest of your body. And there's a massive connection to the pelvis, to the bowel and the brain as well. So if your body is on a good balance, then your brain's functioning right. So the brain fog that women will get doesn't happen. People say when they're pregnant, oh, I've got baby brain, but that's not going to last forever. Whereas it could last 10 years,
Yeah, I think drawing on from what you're saying, we've got signaling systems in our bodies. We've got neural firing electrical signals that are fast responding to stimulus. So the classic, you put your hand on something like a hot stove or an iron, and you move your hand away quickly because you have a reflex response that's quicker. And then you also have a chemical signaling system, which is your endocrine system, and this is the system that we're talking about when we're talking about changes in hormones. And if we have any kind of disruption to that, whether it's not natural or normal, whether it's induced by surgery, so some people go through an early menopause because they have a surgical procedure to remove the ovaries. It could be for a number of reasons. It could be due to symptoms and trying to manage that, but it could also be a cancer or maybe an unfortunate, situation caused through difficulties in childbearing. Any number of reasons might result in a removal of reproductive organs. And that has a massive implication for the rest of the chemical signaling that's going on throughout the entire body. It's not just in that local area. And we've pigeonholed, our kind of genitourinary system and gynecological issues to one region of the body, and it's very much focused on that. But we function entirely because of hormones. Like if we didn't have any hormones, we just would be like neural mush. We would just be, I don't know what we'd be. We certainly wouldn't have sports massage or sports therapy. So I think it's really important to acknowledge that people talk about hormones as though it's just to do with reproduction, but it's literally what makes our bodies work. And the timings are so important. So all of those symptoms that we've, Debs has listed there in the start of the podcast, it could be another, it may not be reproductive symptom, it may not be a symptom of reproductive issues, it might be other hormones that are produced in the body, that might be causing those. And getting medical help can be sometimes really important, even though part of the stigma and the issue with menopause is that we've medicalized something that's a natural age-related transition. So there's all sorts of social kind of issues as well with how we label menopause, because it kind of has an intersect there, doesn't it, between medical and just aging.
Yeah, and from a male therapist perspective, often if people are seeking out therapy, soft tissue therapy, or sports therapy, sports massage, massage in general, most people that are seeking that out, maybe soft tissue, maybe not so much sports, are of a mindset and cash flow situation where we are possibly likely to see more middle-aged women because they have more expendable funds to be spent on private healthcare. So the chances are is that as a male therapist, you will have more mature women coming in and your private therapy. For that reason. Whereas if you're based in a clinic, you may get if you're doing a lot more sports, you may get younger coming in because clubs will pay for it or whatever. But generally in a private sector, you'll probably get more mature women coming in. So I think it's a really important podcast for you to listen to, thinking, oh, I can't just fix their muscles, or their soft tissue is actually responding to something. Could it be menopause? Could it be perimenopause? Let's ask some questions. Are you getting hot flashes at night? Are you on patches or anything? Have you been to see a GP? Let's signpost women and go, the women that come to see me that have gone through these horrible symptoms, and then headaches and like horrible migraines and head crushing feelings and heart palpitations, sleepless night, all sorts of stuff. And then we kind of get to the crux of it, and actually they're 54 years old and they're right slap bang in the middle of perimenopause.
Yeah.
And they go and see the GP. They say, do you know what, I've been seeing my therapist for the last 3 months, and we are together going, yeah, we've built a case, gone to the GP and said, I need to either have HRT or go back onto a pill, or I need you to give me something now to try and balance me out, because I get it, I'm 54, whatever I am, and I want to continue doing whatever I want to do, but I can't do this on my own. And I think some people, from a therapist point of view, will tell you a lot of stuff, but they don't know quite how to handle the GP, or it's embarrassing to go, oh, there's something wrong with me. Nothing wrong with you. And I think from a male therapy perspective, it might be quite difficult to broach that subject. But if they've come to you for a massage to try and help them, and it's not kind of working, could it be perimenopausal? Could it be something else that's underlying? Let's get that kind of settled, and then perhaps we can see an improvement in their thoughts, whatever they're doing, or daily life or whatever. Just a thought.
Yeah, it's really important to have those conversations and earlier rather than later. Don't leave it hanging. If it's a question in your mind that you think it could be a plausible explanation for stuff, if it's starting to build that picture, address it. And I think, like, you actually touched on an issue there that kind of reminded me that so obviously this is just a kind of comparison of the different phases of the menopause and post and perimenopause, but the subject area of like who we're likely to encounter in our clinic spaces is a whole other thing. And if you work in kind of professional teams, sporting team settings, you may be unlikely, not completely not probable, but maybe quite unlikely to encounter a lot of menopausal women, or perimenopausal rather, in your clinic. And just because you are unlikely to see somebody of that typical age range over the age of 40 who should be kind of expecting, perhaps predicting that they may be about to go into some kind of perimenopausal stage, doesn't mean that you won't encounter people who have an early onset of menopause. And there are some people who are maybe biologically predisposed for genetic reasons, and like I said, could be due to surgical intervention. They could be going through an early onset of menopause, and it's really important to recognize the symptoms and familiarize yourself with that. If you're working with women's team sports or individual sports, that's something that is your responsibility to perhaps start looking into. And actually, Debs and I received a message through the WIST podcast, kind of, I think through the Anchor app. You can send questions or answers to us to questions that we've posed. And I did put out a note just to say, if you've got a particular burning question that you'd like us to answer, then please do let us know. And somebody has come back with a specific question about the effect of aging on not cartilage, I think it was different types of collagen as we get older. So the kind of availability of certain resources that might prevent injury as well, like the effect of aging on our tissues, which Debs, you've talked about a little bit. And I can't remember what your response was, because we were kind of thinking, well, maybe we'd do an episode on this type of thing too later down the line.
Sorry to interrupt you. Collagen starts to disappear from the body from the age of 25. So very young. Yeah.
And we always talk about bone mass loss, osteoporosis and risk of fracture actually in older women or women of middle age and over, which starts to occur at the similar kind of age. At the age of 25, I think there's a decline in bone mass, and maintaining that is a lot harder for women than it is for men. But yeah, like collagen is something that can be significantly related to injury or loss of collagen. Elasticity within the tissues is really important for preventing injury. So we need to be aware of these things, professional or not, athletes. We need to be aware of it.
Also, if you're pale hair, pale eyes, you're likely to sort of head down toward osteoporosis. Not necessarily, but it kind of goes within the genetic makeup. Fiona, just before we go, because I know we're going to start to run out of time, I just wanted to share from Healthline. I had a look on Healthline earlier, some home remedies for perimenopause and menopause. I thought it's quite nice to be able to help yourself before you get to the GP saying, I need HRT. You know, you kind of want to help yourself first, I think. So can I just run through some stuff for the listeners? Is that all right?
Yeah, great idea.
Regular exercise, and everyone knows that you need to exercise more, but I'm not saying, okay, you need to go and do, you know, a 25-mile walk or anything like that. You know, 10 minutes a day is pretty cool. You know, it's regular exercise. So something that kind of starts the heart going and moving. So it can improve mood, weight gain, and also the hot flashes, because it starts to regulate the body temperature. So when you come back from a walk, you're quite warm, you know, and it's to go, oh, my body needs to activate, basically. So regular exercise, some form of physical activity in your daily routine. So you don't have to go to a gym and work out. You can literally just go for a walk. But sometimes people start to suffer with insomnia, breaks in sleep through perimenopause. So it'll help you sleep better, basically, if you're exercising. Getting enough rest, and that's not just like lounging around, but actually like working rest as well. You can, you know, work and rest at the same time. You're just in a calm state can help. A lot of women are put on antidepressants because of mood swings, and it's not depression, it's actually the mood swings because of the hormonal imbalances. So yeah, you can change that by moving more, being more, talk to friends as well, you know, whinge if you need to, it's fine, get it out.
Yeah, I think there's that actually is just probably for me triggering just that thought of like, I think there's a generic kind of response that's probably more infuriating than it feels helpful, but like taking care of yourself or telling your client to take care of themselves, because we often put other people first. Where, you know, especially if you're a therapist yourself and you're trying to heed some, you know, new advice here, like you're probably naturally predisposed to just doing things to help other people before you take care of yourself. So yeah.
I'm going to say here as well, to do some sort of relaxing stuff before bed. So gentle yoga, maybe read, go and have a warm bath, try not to sleep during the day, even though you're feeling really tired, try not to sleep, try and sort of eke it out, go to bed a bit earlier, but I think they call it sleep hygiene. I think Matt's done our whole series on sleep on podcasts under the STA podcast. Go and have a listen to those, they're incredible. But sleep incredibly important for our functions, our brain function, body function, everything. So a sleep hygiene routine is always good. And then paying attention to what you're eating. I'm always banging on about what you should be eating and what helps. Avoiding massive meals, try and eat like little and often. If you smoke, just stop. Why are you smoking? Just stop. I have nothing to say on that. Just stop. I smoke, I've stopped. Only drink alcohol in moderation. That kind of goes without saying. This is on here. And then limit caffeine. People have way too much caffeine. Yeah, it's gonna spike. And we all do stuff. We know what we should be doing. And actually, when you're not feeling well, and then you put into practice some of these things, which are pretty obvious, you start to feel well, and then you forget, and then you go back to your old ways. So I think it's a lifestyle choice. I said this back in the endometriosis podcast. Endometriosis and diet, and why we're on a diet. It shouldn't be dieting. It's your life. It's the way your life is. But I thought it was quite helpful to share, because there's
some great ideas there, and like, you know, for some people those will be new ideas, some will be old, and sometimes it's just hearing it again to just remind you like, oh yeah, that did actually work for me, maybe I should do that, you know, switch to decaf for a week or two and just see if it, I mean, maybe a month or two actually is probably, that's another thing as well. How much time should you commit if you've got a monthly cycle or a bi-monthly cycle or whatever it is that you're experiencing? Like, just try to try it across the whole length of that window and see if it helps.
I think I think on an ending note, really, for this podcast, is that menopause, perimenopause is a natural transitional change that we all go through. I mean, I remember it being called the change, that's what we called it. And it's okay. Yes, we've got some horrible symptoms and side effects to stuff, but it's not something that should be dampened down. It's just, how do we alleviate symptoms of the transitional change? And I think if you kind of get into that mindset, it's a lot easier to sort of handle it. You're not abnormal. It's not that you're in a bad place. It's just that we're just changing again.
And treating clients and those around us who are going through that with some reverence and maybe respect and mindfulness that their world is different to whatever we're going through, their version of life.
Absolutely. Okay. So
over
to you, Fiona.
Yeah, so I mean, obviously that seems to be all that we can offer you this episode. We've given you a nice overview of the different phases of menopause, and hopefully it's helped bring some of these issues to your attention. And if you work in sports therapy or a related field and you want to learn more about topics like this, obviously please do call upon our resources on the STA and WIST websites, and we have other episodes that might be helpful to you.
Yep, and all the episodes are available across all of your favourite podcasting platforms, including Spotify and the Apple Podcasts.
And you can access those by just subscribing. So just hit subscribe and you should get them as soon as they are released.
Hope for that. You can check out the previous episodes now on your podcasting platform of choice.
So I think we've got an email address if you want to reach us as well, at wist@thesta.co.uk. That's WIST@thesta.co.uk. Any questions? You can also respond to polls that we put up on our podcasting pages through Spotify, I think, and Anchor apps. So
website, you can also find the links onto the YouTube and video recordings. If you hit into YouTube, which is where I went and found Jenny Burrell's one, you just hit into YouTube, put the Sports Therapy Association, and you can find them all on YouTube as well. So I think that's quite handy. So that's all from me. I'm out of here.
Yeah, that is. Yeah, so we'll catch you hopefully in the next episode.
Thanks everyone.
Bye.